Okay.
So,
That's good.
Charles, getting back to Ken's question, many prostate cancers have proximity to the urethra. Back in the 90s, whole mound sections would demonstrate, 80% of cancers are within 3 to 5 millimeters of the urethra. We're in a different age now because the tumor volumes are less. But let's say you had a cancer that was near the urethra and you had to freeze that area. If you got a focal area or slough or eschar, that really shouldn't cause too much in terms of symptoms for the patient, would it? Or have you experienced that?
Correct. Typically, it wouldn't, like you said. Again, if you're only going after sagittal one area that's going to be somewhat close to the urethra, I think we would be fine. So looking at this, I'm going to go to a sagittal image. We're getting close to finishing this cycle, so I'll just have to double check to make sure everything's looking good here. So here's the sagittal image. I'll take you over to the left side initially, and then you can see the prostate there, inferior on the posterior lateral, that's been spared. As we move more towards the midline anterior, there's a nice ice ball there. There's a midline here with the catheter in place, and here's coming over to the right side, all of the ice there as well, encompassing the entire right side of the gland. So visually it looks good, and temperature it looks good as well.